Hi, everyone. So today we're going to cover a recent FDA approval that addresses some long-standing challenges in migraine treatment. In April 2025, the FDA approved Atzumi. So Atzumi is dihydroergotamine, or DHE. However, it's delivered as a nasal powder. So this would be instead of through injections or traditional nasal sprays. So to understand why this matters, we need to talk about the problems with current migraine treatments. When you're having a migraine attack, your digestive system slows down or it stops working properly. And this is called gastroparesis. So oral medications might not get absorbed when you need the most. Essentially, during a migraine attack, gastric stasis occurs, or it can occur rather. And this means your stomach empties much more slowly than normal. This migraine-related gastroparesis significantly impacts how well these oral medications are absorbed, since they need to reach the small intestine for proper absorption. Now, current treatments like oral triptans and NSAIDs can be limited by this delayed gastric emptying. Also, they often have their own side effects and contraindications as well. Now, DHE has unique properties that make it effective for migraine. And some of those are that it acts primarily as an agonist, not just at one serotonin receptor, but multiple serotonin receptors. And it also impacts adrenergic, cholinergic, and dopaminergic receptors. So this broader receptor activity may explain why it can be effective in patients who don't respond well to triptans. Now, DHE has several clinical advantages as well. It maintains sustained efficacy even when taken hours after attack onset. Now, why is this crucial? Well, that means it's effective even when central sensitization, or what may result from central sensitization, such as cutaneous allodynia, and that's when normal touch becomes painful. So it works even when cutaneous allodynia is present, and we know when cutaneous allodynia sets in, that's when migraine medications have the least efficacy. It's so much better to take migraine medications before cutaneous allodynia. And so the fact that you could take DHE after that and it maintains its effectiveness is substantial. It's very important. And DHE also has reduced rates of migraine recurrence, which is incredibly important and actually helps with migraine overuse headache, or better known as migraine adaptation headache. So the challenge with DHE has been the delivery, right? So injectable forms work well, but they're not practical for most patients. Now, there are intranasal formulations. Migrainal is one of them. And Migrainal had issues with inconsistent absorption and required refrigeration. And now the answer to Migrainal was Trudhesa. And this improved on these problems, and it's currently available. Now, Atzumi, the new medication that was recently FDA approved, uses simple MucoAdhesive release technology. So the key difference is in how it achieves mucosal deposition. So the powder adheres to the nasal mucosa and creates a steep concentration gradient, which enables rapid absorption while providing prolonged retention for sustained therapeutic effect. So this pharmacology shows that 5.2 milligrams of Atzumi results in rapid and elevated plasma DHE levels within 20 minutes with higher systemic exposure than conventional liquid nasal DHE formulations. So what this means is that the absorption is consistent both between different people and also within the same person across multiple uses. So this consistency is actually what we need for migraine attacks, for migraine attack treatment. It's crucial for acute migraine treatment, where rapid and predictable onset of action is essential for effective relief. Now, the clinical development program included phase 1 pharmacokinetic studies, and it demonstrated rapid absorption. It demonstrated high plasma DHE. It demonstrated a low dose-to-dose variability. Now, the pivotal study was ASCEND, a phase 3 open-label long-term safety study of repeated as-needed dosing over 12 months in adults with migraine. And what it found was that 34.2% of patients achieved pain freedom at 2 hours post-treatment. And only about 20% of patients utilized rescue medication. So what this shows is that most migraine attacks were successfully managed with Atzumi alone without needing any additional treatment. So from a safety perspective, Atzumi was well tolerated throughout this 12-month period, this 12-month evaluation period, and no new safety findings were identified following multiple applications. So the established safety profile extends its clinical applicability for long-term use. Why should we care about this? Well, if you're a patient, Atzumi offers some real advantages. First, there's no needles. It's self-administered, simple nasal device. Second, no refrigeration is needed, so you can actually carry it with you because we can't predict when we will have a migraine attack. Third, it works consistently because the powder delivery system solves those absorption problems we talked about. And for healthcare providers, how is this beneficial for your patients? Well, this gives you a reliable DHE option that patients can actually use at home. This could prevent visits to the emergency department. So, like all DHE formulations, however, Atzumi does have contraindications. It's not appropriate for patients with cardiovascular, cerebrovascular, or peripheral vascular disease because DHE has vasoconstrictive properties. So, cardiovascular assessment is recommended prior to initiating the treatment. So, what's the bottom line? Atzumi is a genuine advance in migraine treatment. It takes a medication that doctors have long considered highly effective, and it makes it actually practical for real-world use. So this is something to follow, something to consider, something to keep in the back of your mind. Thank you for watching, and don't forget to subscribe for more updates on migraine treatments. Take care.